Over 12 Secretary Generals of different Red Cross national societies are meeting to deliberate cross-border collaboration in Ebola virus disease and other epidemics preparedness and response national society. The Director, Public Health at the Ministry of Health, Dr. Daniel Chabayinze, notes that engaging communities is key in cross-border collaboration in managing epidemics.
Uganda is part of the greater East African community and also part of the Horn of Africa, where we know epidemics are bound to happen, different epidemics. But maybe we talk about the viral hemorrhagic fevers like Ebola and Marburg have occurred in the region. And borders will always happen, and they do not respect the political borders, because communities live on either sides of the divide of each country. And the best way to manage epidemics is to handle them at source. Source meaning we have to have preparedness, we must have surveillance going on so that whatever information we get, we can use it. Especially today when we are talking about cross-border collaborations. Uganda is part of the East African one-stop border points, and also we employ the port health agencies to help, so that if people are crossing between two different territories, we are aware of their health statuses.
The Secretary General of URCS, Robert Kwesigwa, says that epidemics and health emergencies do not recognize physical borders, so quick response frameworks and rules of engagement should be put in place.
If we invest, and that can also help us to invest in having robust accounting systems, robust supply chain procurement systems, we can do it. We can do it. And so one of the things we are going to discuss during this time, I know it is an ongoing discussion, because even at the global level there has been this localization agenda. How do you take responsibility for the local actors? So part of the discussions this week or today and tomorrow is, as national societies, we can do it. Yes, if this pattern has been well, help us strengthen our systems for accountability purposes. Let our leaders be leaders in the real sense, and let us have the right human resource.
The meeting develops a collective roadmap for cross-border collaboration on epidemic preparedness.
We also made a task force that is chaired by the Secretary General and has representation from the various directorates within the national societies, taking a whole of the national society approach to responding, because it's not only a matter of the health directorate, but all the other key directorates that support programming like finance, supply chain, human resources, operations, even audit and risk management. So we all join in and plan and to support the epidemic response.
The meeting develops a collective roadmap for cross-border collaboration on epidemic preparedness. Kenya, Tanzania, Burundi, Rwanda, South Sudan, DRC, Ethiopia and Madagascar have sent representatives.